My job at the moment is as a commissioning manager for urgent care. So urgent care would mean things like access to your GP. It would be things that were going on in primary care in the community around avoiding admissions to hospital, support for patients who've got respiratory problems, the accident and emergency department, how that was actually being utilised, those sorts of things. So there's a lot of different sort of aspects to urgent care. I qualified as a physiotherapist some years ago, and I went into physiotherapy because I was very keen on influencing people's health, improving all sorts of conditions, of which physiotherapy involves neurological problems, musculoskeletal problems, paediatrics, respiratory care. There's lots of different parts to the management of different conditions in physiotherapy. I worked as a clinical lead for many years in different parts of the service, ending up mainly doing musculoskeletal conditions. And then there was an opportunity to take more of a leadership role, and I stepped up to that opportunity and found myself very surprised about how much I enjoyed contributing to shaping the services and changing them and challenging people to actually try doing things differently. And an opportunity came up on a professional executive committee that is part of the Primary Care Trust for a clinical lead, and it was as a consequence of that I then went on to this commissioning manager role as well. It's a post that sits clearly within the Primary Care Trust non-clinical services now, but it has links with a lot of different aspects of the Primary Care Trust in terms of who I have to work with. For any of the changes to occur that we need to happen within health service reform, we have got to have clinical engagement. We've got to have the services that are delivering that very care on board to modify, to change, to look at doing things differently. So the engagement and the networking has got to be as wide as you can possibly make it. So that is with all teams, all clinical teams, clinical leads, GPs, practice managers, the practice-based commissioners who meet in the different clusters with different parts of the organisations, mental health trusts, social care services, ambulance services, the acute trust, trying to influence some of them in terms of changing the service in how it needs to be delivered, not just now, but in plans for the future as well. I think the more that you listen to the views of other people and take those on board and understand different people's perspectives, the better you will be at achieving what you need to achieve. If you'd asked me probably 5 years ago, or certainly 10 years ago, I never would have thought that I would have been stepping away from being a clinician. That's not what I thought at that time, because I so passionately wanted to deliver clinical services myself. But things change, and you sometimes surprise yourself about your skills and abilities in certain areas. And what I was able to see was that my influence was wider and of more of an impact to more of a number of people than just the 10 people I might see in a clinic morning, that I was going to have more of an effect on hundreds of people in terms of changing services.